Okay, this is Cassidy Steinbruner with What Could Go Wrong with my guest, Talia. And a lot could go wrong, and we have found that out tonight. We have found that out
For
tonight during
sure.
recording, that a lot can go wrong.
I fell out of a chair.
Yeah, we've had one accident, and then we've restarted this recording twice. And what's the bad part about it is that our subject tonight is actually really serious and depressing,
Which is
but
only
we
going to
have,
make this worse.
yes, and we have started with a very odd beginning. Um,
Indeed.
so our subject tonight is a mixture of things. We're going to go and talk from everything from birth control to fertility to miscarriage. And it's a lot of issues, especially miscarriage and fertility, that people do not want to talk about. And even if they do want to talk about it, a lot of people don't know what to say whenever they do talk about it. Because unless you've gone through it yourself, one or the other or both, you don't really know what to say. Now, when it comes to birth control, I think that that's a very heated debate because some people are
Indeed.
for it, some people are for it, some people are very against it, and some people are really undecided because it's like they want to be for it, but they don't know what's right. And, they have all these ideas and concerns. And I understand because living in today's age where it's just normalized to be promiscuous and everything else, it's like the main thing is getting the best birth control with the least side effects because you don't want to change your lifestyle. You just want something to protect you from your lifestyle choices, which that's a whole nother can of worms that we won't get into right now. But right now, we're going to start with, I think, the most serious of, well, the two out of the three that's the most serious, and that is miscarriage and fertility. Now, I actually, this is where I have a hard time talking about this one particular subject because when it comes to miscarriage, I can't actually tell you yes or no on whether or not I've ever had one because I've had so many fertility issues that I can't really say for sure because I wouldn't really know. So my experience is more in the fertility range, but I know that miscarriage, it affects 23 million people a year. And it's one of those things that you don't want to talk about because it's very emotional and painful, sometimes embarrassing. Sometimes people don't want their family to even know. And even if their family did know, they're worried that, their family won't be understanding of it, I think. But even though I don't personally have a lot of experience with that particular part of this discussion, I'm going to kind of pass over the conversation to Talia for this one because I don't want to misspeak on things that I have very little experience with myself.
Well, to be fair, I don't have that much experience either, but I guess like if you intimately know about one, you probably know about the rest. I mean, what do you want to know about miscarriages? Like, I know people don't really talk about them, and like you said earlier, there are about 23 million miscarriages a year. 1 in 4 women will suffer a miscarriage at some point in her life. So that means that if you know 4 women, one of them has had or is going to have a miscarriage one day. One of them. That's 25% of women. Now you have to realize that's also like, I want to say it's 20% of pregnancies end in miscarriage.
Yeah.
That's 1/5 of pregnancies worldwide that they
Right.
know of.
Mhm.
And I know in a lot of places, a lot of people will try to say, well, the mother must have been doing this or that, or she just wasn't taking her vitamins, blah, 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 blah. But In 99.99999% of cases with miscarriage, it is no one's fault but the cruel lottery of genetic chance. That's it. Sometimes it just doesn't work out. Like mine. It was the cruel lottery of genetic chance. Found out I was pregnant at what? 6 weeks? No, 6 weeks or something like that. Lost it at 8 weeks and 5 days. Yeah, that was not a fun experience.
Yeah.
But as for the fertility side, I actually probably know more about infertility than I do miscarriage. Only because I lived with someone who was unable to have children for most of my life. And so I know a lot about infertility and about how it can be caused by all sorts of things. Like, if you have any sort of chronic illness, like, say, especially PCOS, because that is the chronic illness for fertility issues, but things like MS, fibromyalgia, basically pretty much any chronic illness can have an effect on a woman's fertility. So you should like if you're trying to get pregnant or you think you're pregnant, you should always talk to your doctor about if you have any chronic illnesses that you know about.
So, yeah, see, I don't have a lot of experience with miscarriage personally that I know of. I know that I thought I was having a miscarriage whenever I was pregnant with my youngest daughter because I had a problem where I bled through all my pregnancies. Or both my pregnancies, I should say. And apparently that is hereditary because I guess that happened with my mother too. So I bled heavily through both pregnancies.
Just a quick question. Do they know if it was an incompetent cervix or a subchorionic hematoma?
I don't know. The only thing they ever said about my cervix was, "Oh, you have a tilted cervix." And
Which
that's
just means that
it.
your uterus is tilted.
Yes.
That's it.
So it wasn't a big deal. I was told it was extremely common and most women have it. So I never thought much about it, and they never gave me an answer for why I bled during pregnancy. But I didn't bleed very heavily with my first daughter. It was my second daughter that I did, and I actually bled so heavily that I thought I was miscarrying.
That was when you had the window.
Yeah, I think so.
Yeah, I think that was when you
Um,
had the window.
yeah, it was very very scary. I definitely feel for women who do have miscarriages.
Cassidy is a world champion in traumatic pregnancies, just in case anyone needed to know that. Not exactly a fun award to have, but Cassidy definitely knows about traumatic pregnancies.
Yes. I I don't think I've had a normal pregnancy. Out of both of them, I've not had a normal one yet. So,
Yet, I love it.
yeah, yet. If I have another one, it'll be purely like, I don't know. It'll be like the creepiest thing in the world. Because, yeah, we won't talk
Ghost
about that.
babies.
Yes. But see, I guess my experience is mainly with fertility issues because I was diagnosed with the am if I can say it, amenorrhea. I was diagnosed with that many times. And amenorrhea is just where you go sometimes up to 3 months at a time with no period.
Had that on birth control.
Yes. So it's kind of like birth control, but it's like your body is just turning off randomly. And a lot of things can cause it. I mean, it can be stress, diet, too much exercise, health conditions, medication, it really can be a ton of things that can cause it. And the doctor always told me that my reason for having it was because I was always so stressed out because we had a very high stress life. And I was always told, well, cut back on the stress and then you won't have
Nah.
fertility issues. And I just think, that's easy. Why didn't I think of that? But yeah, so I
Sorry,
was
the
told,
husband and the whole family comes with stress.
Yeah, exactly. And then of course if you get into talking about your life and how you're stressed and why you're stressed, then they just ask you, "Well, why are you trying to get pregnant anyway?" That's always been the argument that's been used against me is
Because weirdly enough, go ahead.
if it's so stressful, then why bring another baby into it? Do you not think that's more stress?
No, because weirdly enough, the more you add to the mix, the more it kind of balances itself out, and you're like, eh, nobody's dying today. Everybody's cool. This is nice. I'm gonna read a book. I'm out.
Yeah.
It's actually pretty
Um
cool.
I I don't know. I got pretty obsessed with my fertility problems. I was really obsessed. I would buy these 50-pack pregnancy tests and 50-pack ovulation tests from Amazon, and I would just like go overboard checking things every month, and
Oh
I
God,
got
I know that feel.
obsessed. I was obsessed, and that was stress in itself.
Yeah.
Um,
The actual
that
stress of
was
trying to get pregnant is like
yes,
making it harder
yes.
to get pregnant.
And I remember talking to a doctor about it because I had had a few false positives, which are the worst, because thinking that you finally are and then finding out that you're not is, I want to say, even more devastating than just having a negative. Uh,
Yeah.
it is. And it's embarrassing. It's really embarrassing to go to the doctor, tell them that you had well, you don't start out the conversation with, I had a false positive. You tell them that you had a positive, and then they later, completely devastate you by saying, well, actually, no, it wasn't. I've had blood tests after blood tests done because, the urine test, the urinalysis was not good enough. And I would insist, I'd be like, no, do the blood test. And they would
Do
do
the blood
that.
test.
Like I literally I have medical bills because my insurance wouldn't cover it, and I would just tell them I would pay out of pocket for it, and I still have medical debt for all the blood tests that I had done, um, to check for that early that early little bit of evidence that never came, and it's devastating. It really is.
I feel
Um,
that down in my plums.
yeah.
My lady plums. No, because like I totally understand that like month after month buying so many sets of ovulation test strips, pregnancy test strips. So I think it took me like oh geez, a long time to get pregnant with this one. But I just lost my train of thought. Yeah, I lost it. It's gone. Say bye-bye to the train of thought because this is out of here. But I do know all about that stress about all the tests, and then you think you see a line, so you wait another day to see if it'll get darker. And it does get a little bit darker. And then you wait another day to see if it
Yep.
gets darker, and you're like,
Yep.
"Oh,
Yep. Yep.
yeah, it's
Yep.
a little bit darker. I should make a doctor's appointment." And then the next day, it's a little bit lighter. And you're
Yeah,
like,
it's so depressing. It's so depressing.
"Why me?
Um,
Why do you give me this false hope?"
yeah, I mean, I definitely feel for women who have to get fertility treatments, and I will say that if you do get fertility treatments, you are very privileged because if I had had the option to get one, I would have. Um, and of course, I didn't because I didn't have the financial ability to do that. But anyone who has that ability, like you're you're privileged even though you're also suffering, you know. And
Yeah,
I because I didn't have that option and I just knew it's like my body was betraying me. And when you're a woman and that's like something that you are supposed to be able to do, like and you can't do it, it feels like you are less.
Yeah.
And that was my main thing. And I'm glad that I really had a supportive husband to go through that with, because that was my main thing, was feeling like less, and like I couldn't do something that everyone else could do. And I didn't understand why it was so hard for me. And I just, I feel for women who struggle, because it just makes you feel like, just it makes you feel so small as a
Yeah.
woman.
Yeah.
But yeah, and two, I think it's hard too whenever like everyone around you, it seems like it's easy for them. And whether it was or not, it just seems that way to you personally. Because like it doesn't even mean that it was easy for that person to get pregnant or whatever, but if like you're struggling and then someone else just winds up pregnant, and then you're like looking at them just like, what did you do differently? Because I thought we were doing the same thing and we wound up with different results. Um,
I'm sorry, I
but
don't know.
yeah, like that was always my pain. And my husband shared that pain with me, and it was not anyone's fault. I don't even blame him or myself. Uh, because we couldn't help the situation that we were in, and the hand that you're given, I guess, is what you're given. So you have to learn to be happy with it, even if you're not.
Yeah, you can't ask the dealer for to shuffle out some more.
Yeah, and that's also coming to the point in your life to accept that is sometimes really hard. Um, because now I am getting older, and having just lost my husband, it's
You're
like all these
30.
things. Yes, I
You're
am
literally
30,
30.
but
You're not that old.
yes, but
You're in the prime of life. I know you feel older.
having lost the person that you want to have children with is the
Yeah, that does put a
problem.
damper on things.
Yes,
For
it
sure.
does. It's like, oh, I'll just go on and do this without you. I don't think
Just
that's
be Beverly
possible.
Crusher. Just go be like Beverly Crusher
I guess
with her
I
grandma's
guess
special friend.
I could tell everybody now that I don't have fertility issues, because I technically don't anymore. I could
That's
just
messed up.
pretend. Yeah, I could just pretend.
That's like going blind and saying, "Well, I don't have vision problems anymore."
Exactly. It's like a positive way of looking at a negative. It is a coping mechanism, and I am using it.
With all your
So like,
ability and might.
yes, because otherwise it's just devastating. It's just like, okay.
Yeah, I
Um,
guess I guess it's true. You gotta laugh or else you'll never stop crying.
yes, for sure. But yeah, I mean, Ryan and I went through so much fertility problems for I want to say it was 5 years, almost 5.5 years, I guess, technically speaking, because I always base it off of my youngest daughter, who is now going to be 7 in April. And I have to realize that she's going to be 7. So that means it was 5.5 years that we tried to get pregnant and couldn't. And there was some times that I'm not sure if I was, and I had, like I said, an early miscarriage. I'm not sure. There was some questionable times. There was some very painful times, and some very different times. So and Ryan questioned it too. He didn't know, if I should go to the doctor, and we would just kind of deal with it at home and move on because we didn't know. And also, whenever you're on, you know, you're on Medicaid and stuff, they don't want to cover that kind of stuff. The only thing they want to cover is birth control.
Mm-hmm.
Um, so fertility problems and checking to see if you're pregnant, they don't really want to do.
They'll also cover sterilization. Don't forget
Yeah, they'll
that.
cover that. They'll cover that too, if you're of a certain age and I think have had, what, 3 kids or something?
Oh no, they were trying to push that on me at like 19.
Oh, wow. I didn't know if they did
Yeah.
that young.
Oh yeah. They were like, well,
Yeah.
we really feel like you should get your tubes tied because, oh, what was it? Because you've had 2 C-sections now. And I'm like, excuse me, what?
Yeah.
They haven't stopped pushing it.
They said something similar to me after my second C-section. They said, well, you should always wait 2 years in between C-sections, but now that you've had your second one, we think that you should decide to be done because, you really shouldn't have a third. And I was just like, well, what if I had the next one vaginally? And they're just like, well, that doesn't really make a difference because it's probably going to wind up being a C-section anyway.
Rude.
Yeah. So I was kind of told like what I was supposed to be doing, and I remember just being like, "No, sorry, I'm not gonna do that. I'll decide that later." But
I would have been like, where's your proof that I can't handle a third one?
yeah,
Because they tried that trick with me, and look, here I am with 7 major surgeries under my belt. So
right. Yeah, I mean, I
I caught your
understand.
lies. No, I'm just kidding.
I understand why they don't want people to do too many because it does weaken your muscles down there, and you have the risk of bleeding out with every one because your blood pressure drops. Um,
Oh, yeah, but they artificially pump it up
yes.
because back in June, I don't know if I told you this, but I happened to look over at the blood pressure monitor. It was like
Mhm.
154 over 105. I'm like, dang, they're artificially pumping that up. It's no wonder I felt like an overcooked sausage the next 2 days. Yeah,
Um,
my fingers hurt
but
after that.
but yeah, whenever I had my C-sections, my blood pressure dropped the most with the first. Um, actually, the first C-section is the worst. I have to say that it really is.
It
And
was my
then
fourth for me. I don't remember much about my first, but that was because I had like 2 rounds of spinal block and I was like really doped up on morphine. So I don't remember
right,
much about that. It was an emergency C-section. But like I
yeah,
said, I don't remember much. The second one was fine. The third one was fine. The fourth one scared the absolute patootie out of me.
I um,
Sorry.
yeah, my, I mean, obviously, I have reasons for my first one to have been worse. But I'm mainly talking about pain, not just my daughter's health condition, but like the pain of the first one was so severe. I thought I was being like pulled apart, like pulled in half.
You kind of were.
Um, yes, in a way you kind of are. But the pain was so severe. I remember I had to have 4 nurses come in there and lift each side of the like sheet or whatever I was on and take me to a different table because I refused to get up. I couldn't get up. I was in too much pain. And they were like giving me tons of morphine and it was not working. And I remember crying like a baby. I cried so much. But with my second one, it wasn't like that. It's like, hey, that
Because the
hurt,
scar tissue
but
had already formed.
yeah, I was like, hey, that hurt, but I was up and walking within an hour or two, I think.
Right.
And I'm just like, yeah,
Let's go
but
home.
yeah, let's go home. I'm ready to go home. But now with my first pregnancy, I didn't struggle to get pregnant at all. And with my second pregnancy, I didn't either. And I was still dealing with the same amount of stress with both of those pregnancies, like getting pregnant and everything. Um, but I guess I wasn't trying with either one. And that's the only difference. I wasn't trying.
Just
But
kind
the
of happened.
stress, yeah, but the stress was still there, the same amount, maybe even more so. Um, so I don't really understand how fertility works with stress. um, because I know that I was not less stressed out when I got pregnant both times. I know. But
But was your body stressed more than when you got pregnant?
I don't know. I don't think so. I think I was dealing with way more stress both of those times because my life from
Well,
20,
I'm not talking about like outside stress. I mean your actual body with everything that's going on in your body.
I'm not sure what you mean exactly. Do you mean like period stuff? What do you
No,
mean?
no, the other bloodbath.
Silence. Nothing but silence. I don't know what you mean. I'm still
You
sitting here
see,
just like, oh, okay, there we go.
oh,
Yes. So my personal health, because I have
my
ulcerative
health, my
colitis.
health, my health.
Yeah. I'm
My
gonna start a
personal
rap.
health.
I'm gonna start a rap.
I'm sorry, I can't help myself.
Yeah, yeah, yeah. I have a bowel disease.
Like her. What the word?
No,
Does she do it like this and she wrote?
no, like actually, my bowel disease, which is called ulcerative colitis. I hate calling it a bowel disease because it sounds so, it sounds like icky. Just
I
ick,
call
ick,
it the
ick.
other bloodbath.
But yeah, ulcerative colitis, otherwise known as UC, was actually when I got pregnant with my first daughter, I was actually having a lot of ulcerative colitis problems. Now, when it came to my second daughter, I don't think I was. So, see, that makes no sense either. My fertility
Weird.
makes no sense. No sense at all. Um, but I don't know. Did you have any trouble? Like, how many kids? So you've had seven. How many kids did you have trouble with getting pregnant?
I think it was just this one. Yeah, I think it was just this one.
Do you think that your health had any play in that? Your
No, I'm
age?
just old.
Anything?
I'm just old.
Okay. Okay.
Well, no, because like they treat any pregnancy after 35 like even if you're like 34 and your due date is after your 35th birthday, that pregnancy is
Right.
treated like a geriatric pregnancy. So, they said that while there's no marked decrease in fertility after 30, it can still be get a little bit harder to get pregnant than when you were in your 20s. And I'm pretty sure that's what happened with this. Also, at the time that I was trying to get pregnant, the workplace was super stressful. There was a lot of drama going on. Everybody thought they were going to get fired. So, yeah, that might have been it. But I mean, cuz I'm a lot like my mom in the fact that my husband walks in a room and bam, pregnant. Seriously. Except for this one. This was the only one I actually had to try for. Thank God, because I'm done now. I don't want no more.
Yeah, see, I just don't know. I didn't have any problem with my first two, but I did have problems during the pregnancies themselves. But like I just don't know. I I don't know if exactly what it could have been. I guess I want to blame stress mainly, but when it came to like my age and everything, I don't think that had you know, anything to do with it. But I guess I could also maybe assume that Ryan's health declining over time maybe had something to do with it.
Oh, for sure. I
And
mean, because you always have to remind yourself that getting pregnant is not just a you thing. It also depends on their health and fertility. Or I guess it would be
yeah,
their health and virility. Virile. I had to do
right.
it. I'm sorry.
Yeah. So, I mean, I would like to just point fingers at myself, and maybe that's just because,
That's
you
how
know,
you are.
yeah, and two, like, whenever you're the woman that should be like, that's the thing that makes you different, like you can do this. Oh, women give birth, women have uteruses. And then I'm over here just like screaming at mine. Like, why aren't you working, you
I'm
you absolute
so I just got a visual of
Yes.
you like hunched over yelling at your uterus. Yelling directly at your
I
scar.
I honestly felt like that more times than I can even say. Like I just wanted to be like, you useless piece of crap. You know, what are you even here for besides to make my life miserable? You know? Because I still got all of the like cramps and PMS and everything and hormone problems, but none
Don't
of the things
forget,
that are supposed to go with it.
all of those things go with it, silly goose, including the hot flashes and the night sweats that you'll get in about 25 years.
Well, see, I've already dealt with so many health problems that I've been on steroids so much in my life that I've already dealt with all those things. So I already know what menopause is. I already know, and it
Fun.
sucks.
Is that a cat or a
If
dog? What is.
a
Oh, that's
dog,
both of them. No, there's cat
yes.
and dog.
Yeah, they
I
sleep
see
side
meow.
by side.
I see meow meow and I see dog.
Yeah, my pets are weird. They love to sleep side by side.
I had a kick. Hey, anybody want a kitten? Because while we're on the subject of pregnancy, does anyone want a kitten in April? Seriously, I don't want no more cats. I just had to bury one. Stop telling me no.
Yeah, I don't want a cat, or at least I don't want a kitten. I don't know. I'm really wanting to.
I know
I
you
need to
want to
stop
adopt
watching. I need to stop watching videos on like pet rescues
yeah,
because I keep
just go
seeing
watch
dog
Zaboomafoo
rescues and
instead.
stuff. Keep seeing dog rescues and like these people that go and save dogs from like abused situations, and I'm just like, I should go get another puppy, and I'm just like,
No.
no. Remember what happened last time? Yeah, I have to like reel myself back in to reality. Um,
Yeah, I'm so over taking care of animals.
yeah. I mean, pets are a lot of work, and I don't know. I don't know. I already have 5 kids and 2 pets, and I think that's enough, but I need a monkey. And I need a
I
monkey
said
very
no.
badly.
No.
I need a monkey. They're so
If
cute.
she if she gets a monkey, I want a tiger. I'm gonna become the new.
Tigers are dangerous and monkeys are not.
Travis the chimp.
I'm not asking for a chimp. I'm asking for a tiny little monkey.
Do you not know that tiny little monkeys can also be dangerous and rip your face off?
Oh, what do they do? Just throw like poopy at you?
No, rip your face off with their
Okay,
sharp
well, maybe
nails
I want my
and
face ripped
teeth.
off. Maybe I enjoy that.
Okay, let me put it this way. I had a friend growing up who had a ring-tailed lemur. Real cute, right? It's dang it, I forget what its name was, but that's besides the point. It was Molly. It was Molly. That's right, because Molly the ring-tailed lemur and Molly the dog who lived a block away from each other. Anyway, the Molly the ring-tailed lemur wanted a candle, and I was like, okay, well the candle was not lit, just so you know, everyone. This is fine. It's just like one of those little dollar store candles, right? About that big, probably like 2 inches tall. Anyway, Molly takes the candle and she throws it at her human and hits her in the head. It was funny. But yes,
Sounds funny.
even small monkeys are dangerous.
Good. I want it
I
to
want a
like answer
tiger.
the door. I want it to answer the door whenever it's somebody I don't want to see. Okay. So,
Because.
did you know
Did you know?
that 65% of women are on birth control? It's probably actually a much larger amount, but 65% is what came up on Google. And I don't know because I'm not part of that crowd. I'm not hip and cool. Um, but I but I do know a thing or two for all these young whippersnappers out there.
You're 30! I'm the oldest person in the room! Anyway, these young whippersnappers, as you so affectionately called them.
Yes, these poor little innocent girls that know nothing of life. They are on these confounded.
Little tiny pieces of plastic that look like broken crucifixes.
They are on these bad things called birth controls. And they need to be educated properly because there is no such thing. I gotta say this. There is no such thing as non-hormonal birth control. There is no such thing. Because you know what? I was lied to whenever I got the copper IUD, which was told to me that it was non-hormonal. Now, that is not
Technically, it's
true.
not. But the copper can actually interfere with hormonal responses.
Exactly. So there is no such thing as non-hormonal because they don't tell you that little detail right there whenever you get
It's
it.
a lie.
Yes, it is a lie. And it affected a lot of things, not to mention they knew that I had a condition that makes me not really absorb vitamins very well, especially like I get anemic very quickly, low iron all the time, and the copper IUD actually can cause anemia or make it worse.
Because
And no
the
one
iron
told
in your
me
blood
that.
adheres to the copper.
Yes, no one told me that. And they knew of my condition whenever I had that inserted. And also, they never told me that it was going to cause so much pain. It was going to cause pain in my back. It was going to cause painful intercourse. It was going to cause painful everything. It was not
Painful
fun.
walking.
Yes, it was painful. And they said that you wouldn't be able to feel it, but I could. Uh,
That's what they
yeah,
said
and
about my IUD.
it felt like a pinching, like
Stabby.
tightness, like squeezing feeling way up in your uterus. That's what it felt like because that's what it was. And so when they say that you can't feel it and it's non-hormonal, don't believe them because it's not true. And I don't care if like someone were to, you know, contradict what I just said and say, oh, well, that's just your opinion. That's just, how you felt whenever you're on it. I think most people feel this way, but they just don't say anything because either they think that it's normal or they just deal with it because they don't want the outcome of pregnancy.
When in reality, these funny little IUDs can make it to where you'll never have the outcome of pregnancy
Yeah.
because they migrate into your bowels.
Or you actually are at risk for the ectopic pregnancy, where you're
Yeah,
going to have to undergo a procedure to have
fallopian
that.
tube removed. The one that
Yes,
ruptured because of your
they don't.
ectopic pregnancy. That wasn't supposed to happen because it has a 99% chance of making sure you don't get pregnant. But sometimes it happens. And then you have this ectopic pregnancy that you don't know about because you haven't had a period in 6 months. So how the heck are you supposed to know?
And see that happened to me. So I already had been very irregular my whole life, but after I had my first daughter, I was somewhat regular, and my cycles were somewhat regular. And the reason I had the IUD put in place was because I had had a very traumatic pregnancy. I had PTSD, and I was scared if I got pregnant again, as well as I had had a C-section. I was told don't get pregnant within 2 years, and I was very young and I was very scared. So I had that inserted, and it was less than a year later that I had it removed out of just pure, it was pain. Pain and discomfort, and also I was bleeding heavily. I bled probably like for a straight month almost instead of just a week or so for a period. I bled like continuously almost for a month. Um, so yeah,
Yeah,
very
I did that
uncomfortable.
upon insertion. I bled for 12 weeks and 1 day straight.
Yeah,
Right
that's a
after
long time.
Yeah, having had a kid. Not that was with Morena. And that's the one where they first marketed it as you could only have 4 periods a year. Well, let me tell you how much of a nightmare having only 4 periods a year can be when you're very fertile. Because
Right.
I literally, I mean, I hate to say this, but like, I don't usually have that much of a problem getting pregnant. I mean, first try is when we got pregnant with Finn. Literally, the first try. So when I say it's a nightmare to only have 4 periods a year, it really is. I was stressed out constantly because I didn't know. Could I be pregnant? Could I not be pregnant? Could I be pregnant? Could I not be pregnant? I don't know.
Right.
Yeah, because I mean, at least when you're not on birth control, you have that indicator of your period telling you, "Nah, you didn't get pregnant this year. I'm throwing everything out this year, this month." But
Right.
with Morena, Skyla, and the Copper ID, which I can't remember the name for that one, um, it is more stressful to people such as myself who can get pregnant very easily and at the time did not want to.
Right.
And you don't lose weight on those things either, which is nasty.
Yeah. I was told that with the copper IUD, I would not gain weight. I would not, any of those bad things that like the pill and stuff would do for you.
It's a
Uh,
lie.
yeah, exactly. I did gain weight and it was really bad.
Yeah,
It Yeah, so the official name for it is the Paragard.
Paragard, thank
I
you.
I had that. It was the copper IUD Paragard. And I had done a lot of research into it, or at least I thought I had before I got it. And I mean, there's just no proper birth control out there that you're not going to have to deal with something, and the only safe birth control really is, uh, you
Abstinence.
know, yeah, abstinence and family planning, uh, like, avoiding those times of the month, but you're still at risk. I mean, and
Yeah.
you're still at risk. So literally, abstinence is like the only accurate birth control where you have no hormone problems and no
Yeah.
risk of pregnancy. Like,
And
you've got to
nobody has
choose
to
one
wear
or the
anything.
other.
And nobody
Yes,
has to wear anything uncomfortable. I'm talking
right.
about both diaphragms and condoms.
Yes, I looked into diaphragms. That was actually my next thing after the Paragard got taken out. I was like, well, I'm just going to get a diaphragm. And then I looked into how you have to put it in and stuff, and I'm just like, I can't do that. That is yucky.
That
And
is yucky.
yeah, it's like, am I even an adult? Like, I couldn't
No.
deal with a diaphragm. I couldn't deal with it.
Listen,
And
lady,
so,
I've had a diaphragm in my house since June. I have not opened that thing. I have not touched it. It scares me. Okay? It scares me.
it's scary. It's
It's
scary.
scary.
It
They're like,
is.
do you need someone to show you how to insert it? I'm like, listen, don't you think I've had enough people down there in the last couple of months?
Yeah.
I don't need any help,
It's like,
thanks.
please stay away from down there. It's
Right?
it's a work zone.
It's feeling a little exposed.
Yeah, just let it be. But yeah, I had the option for a diaphragm, and that was my last form of birth control that I was willing to use. And then, I guess lucky enough for me, we converted to Catholicism, and then and then it all went out the door, and I no longer cared anymore because I'm just like, well, if it happens, it happens. And yeah, and then what was so weird about that is as soon as I stopped with birth control and as soon as I
Well,
was
time to
fully
become a Catholic.
yeah, I was fully accepting of the fact that I could get pregnant at any time was when my fertility problems started. Isn't that wild? Isn't that wild? I'm
Like, nah,
trying to
you're good now.
yeah, I'm trying to prevent it briefly. And then I finally accept, hey, you know what? I'm accepting all babies all around the world, whatever. And
No more babies for you.
yes, it's like I got punished. I got punished. No, that's a joke. That's a joke. I didn't get punished.
It's a funny
Um,
joke.
it's a funny joke, but only because I'm the only one crying. Um,
Now I seem like a terrible, evil person. Wait.
no. I mean, yeah. I'm laughing too, so I guess I'm a
Yeah,
terrible
but you're
person
always
as well.
laughing.
I am. I laugh when I'm nervous. I laugh when I'm not happy. I laugh when I am happy. No one knows what to do with me.
She laughs when she's angry, and that's when you should run. True story.
Carissa said her lappy top.
That's funny because that's what I call mine. Listen, it's too much time with small children. Okay, leave us alone.
Okay. So, fertility awareness methods can have a 99% success rate, but typical use of condoms is only 85% successful of avoiding pregnancy. Yeah, I can see
Because
that
condoms can be
because
manufactured with holes.
not to mention crazy people be poking holes in them.
Not to mention, most dudes store condoms in their wallets.
Yeah,
Ew.
yuck. I've never met a guy that did that. That's gross.
Yeah, well, that's probably because you barely met any guys.
True.
You were
I don't know what to
homeschooled,
say
didn't
after
go to the
that.
public school. I was about
I
to
don't know
say,
what to say
you were
after that. That's just
homeschooled.
awkward.
You didn't go to the public school. You didn't really know people when you were in that time where you were supposed to be going crazy, doing crazy things. I
Yeah.
didn't either. I just went to public schools. So I saw a lot of things because I went home and I was usually grounded. So, reading books.
So did you actually see a lot of things, or did you just see your bedroom walls?
No, I saw a lot of things in the school. And then I went home.
And you got grounded for seeing things in the public school?
No, I got grounded for having bad grades. Because I was too busy watching the drama play out.
Look at you, easily distracted.
Well, I do have the ADHD and have had it for my entire life and have been diagnosed for 30 years. Thank you very much.
Where's my diagnosis?
At your doctor's office. You should make an appointment.
Yeah, probably should. I need to get some of whatever you take.
I don't have any Adderall. I don't have any insurance.
What the heck do you take then?
I don't take anything. I don't take anything.
Well, then you're no fun. You're one of those ADHD people that no one wants to be around because you're too ADHD.
You literally only knew me for about 5 minutes when I was medicated. And that was like last year. Not last year. That was 2023. I was medicated in 2023. For most of the time,
that was like the best 5 minutes of our friendship.
Whatever. You're as bad as I am. You dang wombat.
Yeah, that's probably true.
You wallaby. You capybara. Hey!
Is it a capybara or a capybara? I thought it was a capybara.
It depends on what your accent is. Stop watching David Attenborough.
Okay, so you're from the Midwest, and I'm from North Carolina, and I say
first
capybara.
Of all, thank you, Carissa. I couldn't remember which one it was that pooped cubes.
See, she said I'm right. Bara.
Okay, y'all have been watching David Attenborough.
No, I've been learning grammar.
Around here, we call it the capybara.
Maybe around here needs to get a little more around here.
And also, technically, Oklahoma is not Midwest. We're Texas's little sister. Get it right. Hey guys, did you know it's 11 o'clock?
What was that alarm for?
It's 11 o'clock.
Yeah, but what was the alarm for? You just set your alarm for every hour?
No, I set it's for 11 p.m. every night.
That's weird. Why?
No, it's not. So I can take my magnesium so I don't have RLS at night.
Yeah, I have to take magnesium too, or I get really bad leg cramps. All right, so that about sums up our podcast for tonight. Do you have any closing statements, Talia?
I'm an idiot.
Yes, but I meant things that people don't know.
No, I think I'm good there. Because for some
Okay.
reason I really want to be sarcastic and say something completely off the wall.
Well, if you want to say something off the wall, then just say, what do you say?
What do you
Miami?
say? What do you say?
Capybara? I say it the right way.
Capybara.
I say it the right
Capybara.
way. You say it the
Oh
wrong
yeah, oh
way.
yeah, oh yeah. Well, cassowary.
Do you also call potatoes potatoes?
No, who does that?
What about tomatoes and tomatoes?
It's tomatoes. She's actually Paul Giamatti.
That's right. I'm Paul Giamatti, and because I'm Paul Giamatti, I can say things like, this is Cassidy Steinbruner, and you have been listening to What Could Go Wrong.
Everything.